Hi, I'm Dr. Rachel Kennedy at Highland Park Animal Hospital, and we're going to chat today about feline ultrasound.
Dr. Kennedy, what are the most common reasons a cat might need an ultrasound?
I feel like one of the most common reasons that we see is chronic GI issues. Middle-aged older cats, we're often investigating GI disease through ultrasound, but that's just one example. We can also use it for cardiac disease, splenic liver, bladder disease, kidney disease, but specifically a lot of times we're using it for GI.
How is a cat ultrasound different from a CT scan, and when is each one recommended?
Ultrasound is often used for soft tissue organs versus a CT being used more for central and peripheral neurologic disease or for musculoskeletal. There's definitely a place for both. We'll often use CT also for thoracic imaging. We don't have a CT here at our building, so it is something that's referred out for. So we often aren't reading those either, but ultrasound is here at our disposal, and it's a little bit more accessible for the general practitioner.
What is a typical feline ultrasound procedure involved, and is sedation required?
Depends a little bit on the cat. Generally, I find I'm sedating more cats than dogs for ultrasounds. Normally though, and this kind of leads into the next question, is we are having the pets dropped off for a few hours. We do require that they are fasted for the morning before, and then depending on the disposition of the animal, we will either give them a little bit of sedation. We do often shave the abdomen too, so be prepared for a little bit of a haircut with your appointment.
What organs or internal conditions can be evaluated with a feline abdominal or stomach ultrasound?
Virtually all organs can be examined. We can look at the liver, gallbladder, pancreas, stomach, small intestine, colon, kidneys, bladder. Some of the really small organs like the ureters or things like that might require a more specialized hand, but we can definitely get a very good overview and identify a lot of issues with our ultrasound here in a general practice setting.
Are there any risks or discomforts associated with ultrasounds in cats?
No, fortunately it's a very low risk situation for patients. The ultrasound itself doesn't carry any adverse side effects. The biggest, issue would be expense, and that varies case to case, and then also sedation. However, we're generally using a very mild amount of sedative. So yeah, generally a very, very safe imaging procedure that we can get a lot of information from.
How do you explain the difference between diagnostic imaging options to a cat owner concerned about cost or clarity?
Yeah, it depends a little bit on exactly what we're investigating. So for example, if we're looking at a cat that's a chronic vomiter, chronic diarrhea, there is definitely benefit in doing something like an x-ray to rule out obstruction, but ultrasound is really going to be a better way to evaluate organ architecture in those settings. So it's really case by case, and it depends on your specific needs. I would never book an imaging appointment without being recommended to one. There's a good chance you'll book the wrong type and pay for an imaging set that you didn't need. That concludes our video on feline ultrasound. If you have any questions or concerns, give our front desk a call and we will set up a consultation. Thanks.